Hello, and welcome to Healthwatch. I'm your host, Carolyn Wilson, from Ledgelight Health District. Today, I'm joined by Magnussen, who is a public health nurse at Ledgelight Health District. She's also the supervisor of communicable disease prevention and emergency preparedness, and coordinates the Medical Reserve Corps. Chris, welcome, and thank you for being here.
Thank you. Glad to be here.
So let's start by talking about your background. Tell us why you chose a career in nursing and what brought you into public health.
According to my mother, I probably was a caregiver from the time I was a little girl and the eldest of four, so it just seemed logical, and I sort of followed in the steps of a cousin. And been doing it for 46 years, and actually came into public health because somebody had called me about the position and it sounded interesting, it was diverse, and I could use a lot of my skills. Now it's 11 years that I've been at Ledgelight.
Excellent. So. Yeah, I think you and I have been there around the same time.
I think so.
Part of what you do at Ledgelight is communicable disease prevention. Mm-hmm. What are some of the main things you focus on in that role?
Well, a big part of it is, just like it says, trying to prevent infectious disease, probably outbreaks more than anything. So promoting vaccination, promoting healthy habits like hand washing and food safety, and working with partners and doing a lot of education. But also I spend time doing investigations for foodborne illnesses and following up with tuberculosis and such. So that's what's so interesting about it is, you know, so many diverse aspects of communicable disease prevention.
Yeah, it sounds like it keeps you pretty busy.
It does.
Yeah, one thing you and I have in common is we both do a lot of outreach. So I know I keep hand sanitizer with me all the time. What would you say is the number one health tip that you would give most people, how to stay healthy?
Hand washing, hand washing, hand washing. So hand sanitizer is perfect. I get a lot of questions whether that's safe to use. Yes, it's safe to use. In fact, the CDC, Centers for Disease Control and Prevention, have come out and said that hand sanitizer in many ways is better than washing with soap and water, simply because it's easy to do and it gives you a little bit of protection, but there's nothing like just good old hand washing.
All right, that's really good to know. So one of the things I wanted to spend some time on today, it's a big topic, public health preparedness. And I know that requires a lot of planning. I know it keeps you super busy. Can you explain what you do for public health preparedness?
Sure, there's different aspects of it. So actually we get grants, local health departments get grants called the Public Health Emergency Preparedness Grant from the CDC, and hospitals also get grant money. So we work together. We have a lot of collaboration with our partners. There's not anything that, you know, we can always do on our own because we're limited with staff and resources. So there's a lot of collaboration with our partners, whether it be at the local level all the way up to the state. So I do a lot of planning. We've been charged with mass dispensing in the event of a public health emergency. So in the town of Groton, let's say, I spent time with emergency management. We went around and tried to find the best place to do dispensing, and then you have to work with the police. So there's a lot of collaboration, a lot of planning, and now we're the regional lead for the area, so working with our partners to come up with a regional plan. Just like there's regional shelters, regional schools, we're now seeing more and more that we're starting to collaborate and have more regional approach, especially to preparedness, because nobody can do it on their own. They really can't. Right. So I would say planning is a big part of it, training, and doing exercises, of which you've been involved in.
I have.
With our drive-through flu clinics.
Yes.
So,
Wow, that's great. That's like you said, it takes a lot of planning. Seems like there are a lot of partners involved.
it's a lot of planning, writing plans, which I enjoy. Most people don't, but I enjoy it. It's like putting puzzles together, working with your partners, and a lot of memorandums of agreement,
Right.
and work closely with the Red Cross, like I say, the local folks,
Sure.
and just
Yeah.
like I say, never a dull moment. Doesn't matter whether it's communicable disease or whether it's emergency preparedness. Every day is different.
Right. That's great. Keeps things nice and interesting. So how do you know what kind of emergencies to prepare for? What dictates that?
Well, you have to sort of look at what the hazards are in your area. So we don't tend to have tornadoes, so we're not going to spend a lot of time, even though a few have touched down in Massachusetts and Connecticut. That's not really one of our big hazards. So every town, every local health department, every hospital does something we call hazard vulnerability analysis. And so we have to look at what the hazards are. And so we all sort of look at it from different ways. What are the hazards? What's the probability of something happening? What can we do to mitigate, to make, hopefully we won't have big issues if we're ready? How do we respond to an event? And then how do we recover? So those are all the things that determine what our hazards are. So for our area, flooding is our biggest hazard, but we also talk about hurricanes, winter storms, so we've kind of grouped it together to weather events, because ultimately, what does it lead to? Power outage. So that's a big one. The other is infectious disease, because now look, we've got measles that's occurring in the news. Thankfully, it's not been an issue here. We have always the threat of a pandemic, like we had with H1N1. Every year we have the flu, which kills people. So that's the second thing that we look at. And as a region, we've accepted that as our hazard. The third one we've looked at is bioterrorism. That's always a threat with the world that we live in. The fourth one that we've decided as a region, that also Ledgelight, all of us really worry about, is violence. Violence in the workplace, violence in the schools, public, any number of things. And so that encompasses, unfortunately, things like shootings, mass casualties. And then we just added this year cybersecurity. Very big concerns about cybersecurity. I think everybody has that now as one of their top hazards.
Wow, that is.
So our plans are based on those hazards.
Wow, there's so much to consider. There's a lot to keep you busy, I guess.
It is.
Yeah.
I didn't have any gray hair when I started. Now look.
And it really requires a lot of coordination with different partners and
and that's
coalition building.
And that's what's fun, is we always say you need to know your partners ahead of time and not be exchanging cards at the event, at the emergency.
Yes.
And so you get to know your partners, you know what they can bring to the table, you know who's good at certain things. So we have great partners that we work with.
That's great. That's great. So you mentioned that local health is responsible for mass dispensing in public health emergencies. What exactly does Ledgelight do, and what's involved with mass dispensing?
So actually the government, the federal government, has sort of assigned that task to public health. Just like the federal government is assigned to the Red Cross, that they're in charge of sheltering, mass care. And so that's why we get the grant money, so that we can work on our plans and be ready to dispense, whether it be pills to people or whether it be vaccinations. And so we've done a lot of planning about that. We've done, for 7 years now, we've been doing drive-through flu clinics as a way to exercise. People get their free flu shot, but it allows us to see what works. Do these plans work? And that's a big thing. We don't want the plans on the shelf. We want to know that they work.
Right.
And our partners, like the last time we did it, you were with us in New London, it was 16 organizations that did it with us. Wow. And so they all contributed ways that we could improve, things that worked. And so one of the things we've spent a lot of time on is for bioterrorism, and so pills to people. And so we have the whole plan there, where basically people would go online, they would fill out information, and then a voucher would be printed that would say which antibiotic they get in the event of, let's say, anthrax. If they don't have that, then a computer or printer, then that would be taken care of at the mass dispensing site. So Fitch High School is our primary dispensing site, just like it was during H1N1. That was one of the sites And so we have to work with the police, we have to work with the local emergency managers, we have to work even with transit, with public works. We have to work with all of these folks and the schools to come together. So if something like this should happen, we're ready. We can open our doors quickly and hopefully get everybody through the line.
That's great.
At a decent pace.
So
hopefully.
important. All right, well, we're going to take a short break. We'll see you right back here in a few minutes on Healthwatch.
Oh, look, a redhead. Staring contest. You still got it.
I know.
Come alive with the forest.
The dad was cute.
You were looking right at us.
Visit discovertheforest.org to find a forest near you.
Home fire drills give your family a plan of action. In a home fire, you may have less than 2 minutes to get out. So when you drill, show everyone 2 ways out of the house, pick a safe meeting spot, and get there in under 2 minutes. Then practice home fire drills at least twice a year. You can even make them fun. So everyone knows the sound and exactly what to do when they hear a smoke alarm. Go to ready.gov/fire drill and learn how to prepare your family for home fires.
We believe that when the community comes together, we can do great things.
We're working to make Groton the healthiest and safest place for everyone.
Hey kids, listen to your parents.
We want you to have the facts and the best tools to keep you safe.
We know there is a lot of confusing talk about drugs in the media.
Parents, we know you have a tough job to do, teaching your kids about alcohol and drug abuse. We're here to help you.
Let's work together to change community norms about drugs and alcohol.
Help us out. Volunteer. Donate.
Find us at Groton Prevents and join us.
Welcome back to Healthwatch. If you're just tuning in now, I'm joined today by Kris Magnussen, public health nurse at Ledgelight Health District. And today we're talking about emergency preparedness. So Kris, I was just watching the news and I learned that it's actually Hurricane Week.
It is.
What can people do to be prepared?
Well, I think first and foremost, people need to have plans in place, and they need to think about what would happen if a hurricane did come. And not that we get many, thankfully, but we get tropical storms. Mm-hmm. And again, I think the important thing to keep in mind is that power can go, and especially if you have your own well and septic, those are things you want to consider. But I think that people need to take some responsibility. They need to plan, especially if they have young children, if they're elderly, if there's any special needs. Too often we would see at the shelters when people have been told to evacuate mm-hmm. that they would wait till the last minute, then they would show up and they'd forget their oxygen tank, they couldn't carry it, or they'd forget their glasses or their mm-hmm. hearing aid. So people need to think about these things beforehand and not wait. So they should think about communication plan, especially if you have children. What happens if you're evacuated and you're at work and your children at school? You know, where are you going to meet? Or even just any family member. You need to think about having enough food in the house and water. And sometimes that can be a little bit of financial burden. So think about things like peanut butter, canned ham, things that don't need refrigeration. And people should have at least a gallon of water per person a day. So, you know, a lot of people have bottled water, so just sort of keep restocking as you start to use it up. And we've had instances where people haven't even had a flashlight or didn't have batteries. So people need to think ahead of time, be prepared, and then think about what's happened around the country with flooding. And let's say some flooding is a big issue in this area. If all of a sudden your home is flooded, you know, what are you going to do? Do you know where your important papers are if you had to evacuate quickly? Do you even have phone numbers? We all rely on just pushing buttons on our phone. I don't know my father's phone number by heart anymore. So you know, you need to have all of that information available. There's so much that you can turn to. Ready.gov, even your town. Also, I think to just stay in touch and know where the shelters are, know the evacuation routes, know what's going on. And so to sign up with your towns, most towns have the ability to sign up with the emergency management to get notifications either by your landline or by your cell phone that maybe a storm is coming, and start getting prepared. So like I said, people need to give some thought about the things that have happened in the past and, you know, what they should do to be ready and not be caught off guard.
Yeah, those are some really great tips. I know that for a while people never knew what to do with their pets, so I think shelters are more
and that's
open
the
to
other
having
thing
pets
is
now.
that, you know, we learned during Katrina that people wouldn't go to shelters because they couldn't take their pets. So that's not the issue anymore. But again, you need to know where your shelters are. We have regional shelters, but the towns also are responsible, so a town might set up their own shelter. But check when they're Red Cross shelters, they usually have a place for the animals. So, but you need to have materials for you need to have, you know, a little cage, kennel, whatever you want to call it for your pets. You need to have food. You need to bring those things. And speaking of food, if you're on special diet and you go to a shelter, try to bring your special foods. I've been in shelters where people are diabetics, gluten-free, and you get what you get.
So planning once again.
So planning, plan ahead.
Yeah.
We always think it's not going to happen, and you hear this time and time when people are interviewed on TV. I never thought this would happen. Now I've lost my home. So just sit down, think about these things. Go to your websites, like I say, FEMA, Ready.gov, Connecticut Prepares, and to your town.
Yep.
And if you have any type of dependency on electrical equipment, oxygen, any type of cardiac device, and you can't have a generator for whatever reason, or you have trouble with mobility and you're in a wheelchair, you need to talk to your emergency manager. You need to let them know that so that they can reach out to you and maybe help transfer you to a shelter if need be, and not
so
wait
important.
till the last minute to call.
Right, so important. Real quick, what are some things that people should have in an emergency kit?
Well, I think first and foremost, people should have food at home so that they can reach. And like I say, you know, you could have something like crackers and peanut butter and the canned hams that are very inexpensive. And you could have canned items as long as you have a can opener. But you have to try to find things, granola bars, cereal, things that are going to provide you some nutrition. But also people should have first aid kits. If you're going to be evacuating, you need to think about your medications. You need to think about your glasses, your hearing aids. You need to think about important insurance information, so if you come back home and everything's destroyed, you know who to call. One of the big issues we always run into when somebody comes to a shelter is they don't know who the vendors are that they deal with for their oxygen. We want to call their oxygen company and they can't remember, or they can't remember who their home care company is. So just spending time ahead of time, writing these things down, sticking them in your wallet, knowing what your medications are, that would be a tremendous help. But just stop and think about, if all of a sudden you lost power, what do you need? What do I need to survive for that time? And it doesn't hurt to have supplies in the car, because you may not be at home when you have to evacuate. And I'm not saying you have a suitcase ready to go, a go bag, but you know, you need to always make sure you have enough medications, enough food. And again, we usually have a little bit of lead time when a storm is coming. So that's when people should be going out and taking care of these things.
Technology helps. So on that vein, what about social media? Is social media an important tool with emergencies and planning?
Yeah, social media is very important, but there's the good side and there's the bad side. So social media very often will keep people apprised of what's going on. Oftentimes that's where people hear about an incident for the first time. But we have to be careful sometimes, because people will try to give you information that may be a little slanted, may not be correct. So you need to be a little careful and always want to go to a reliable source for that information. However, we do have a team in the area called the Virtual Operations Support Team that is part of the Medical Reserve Corps, and actually they can help during events and emergencies by going in and monitoring social media, because oftentimes people will go onto social media to say, you know, we're trapped. They'll go onto Twitter, they'll and say, we're trapped, the water's coming up, help. And actually there have been instances where with social media that people have been able to monitor and let the authorities know that this is happening, can you go try to rescue that person?
Wow,
so
that's
it certainly has its place, but again, you got to be careful with the information that you're being provided on maybe how to prepare, especially health information.
Right, right. So let's talk a little bit about the Medical Reserve Corps.
Yeah.
What is it, and is there anything required to be part of it?
No. So Medical Reserve Corps came around after 9/11, and actually President Bush asked for something along this line to be created, and so it's actually a federal program. And it is allowing us to credential and train volunteers to respond to public health emergencies. It's a little bit of a misnomer when it says Medical Reserve Corps, because people think they have to have some type of medical nursing background. That's not the case. Medical and non-medical, it's basically somebody who's over the age of 18 that likes to help other people, would like to be involved in their community, because we do respond to public health emergencies. Probably our biggest one to date was H1N1. We gave over 11,000 flu shots during H1N1, and it was the volunteers. We could not have done it without our volunteers, because there are only, what, 23, 25 of us at Ledgelight, so and I'm the only nurse.
Right.
So I'd be still giving shots to people if we were doing 11,000. So the volunteers assist with, they do a lot of training, exercising, they assist with sheltering. We work closely with the Red Cross, we train with the Red Cross. Like I said, they're responsible for sheltering, but they have limited volunteers too. So we train with them so that our health staff, especially our nurses, physicians, EMTs, can go help with the health end of a shelter. But we've also had our non-medical folks help at shelters with registration, feeding, whatever is required. So like I say, it's a federal program. Most local health districts in Connecticut have a Medical Reserve Corps. We get a little bit of funding through the Department of Public Health. We're always looking for volunteers. They just have to call the office and we'll set them up. We do an orientation. We don't have regular meetings because we realize everybody's busy, so we bring them together when we do have something to go over. And thankfully we don't have a lot of public health emergencies, so our other mission is to help build resilience. So we do blood pressure clinics. At one time we did lead testing in the New London elementary schools. We go to farmers markets and do education. So, you know, we're happy to go out and help in any way we can to educate the community, maybe help them to know their numbers, their blood pressures, do diabetes risk assessments and stuff like that. Wow. So happy to have anybody who just has a desire to help.
That's great.
We'll even give them a nice shirt.
You get a t-shirt, right. Awesome, that's great. So if somebody wants to get more information about that program, they can contact you at Ledgelight Health District?
They can also go on our website and look at www.llht.org, or they can call and speak either to me or to Catherine Dragoo, who coordinates the unit with me. And happy to have them. And hopefully we'll grow our unit. That's our goal, because we know one of these days something could happen, so we want to be prepared.
Yes, that's the theme of today.
Being the good old Girl Scout that I am.
Right, planning and preparedness.
Yep, so.
Great.
So hopefully, and that's the other thing, is having Medical Reserve Corps volunteers, they educate their neighbors, their family, about preparedness, because we always say they have to be prepared before they can help others. So they play an important role in getting the word out to the community about what we do as Ledgelight, but also what they can do to be prepared and work with their communities.
That's a great program. Well, that's all the time we have for today. Thank you, Chris, for sharing
Sure.
all of that important information with us. Thanks for tuning into Healthwatch. We hope you learned something from today's segment, and we hope you'll join us next time here on Healthwatch.